A hernia occurs when an internal part of your body pushes through a weak spot in the muscle or tissue wall that holds it in place. This can happen in various parts of the body, but it is most commonly found in the abdominal area. The pressure from the internal organs or tissues creates a noticeable bulge or lump, which can be painful or uncomfortable. Imagine a bulge or a sac forming under your skin. This is the hernia pushing through the weakened area, creating a visible and often palpable lump. This happens when there's an opening or weakening in your abdominal wall, allowing organs or tissues to protrude. The weakening can be due to various reasons, such as strain, injury, or even a congenital defect. Think of it like an inner tube pushing through a weak spot in a tire. Just as the inner tube creates a bulge in the tire, the hernia creates a bulge in your body. Hernias most commonly occur in the abdomen, but they can also appear in the upper thigh, belly button, and groin areas. Each location has its own specific type of hernia, such as inguinal, femoral, umbilical, and hiatal hernias. Hernias can affect anyone, regardless of age or gender. They are not limited to a specific demographic and can occur in both children and adults. However, some factors can increase your risk, such as heavy lifting, chronic coughing, obesity, and even pregnancy. These activities and conditions can put extra pressure on the abdominal wall, making it more likely for a hernia to develop. Understanding the basics of what a hernia is can empower you to take control of your health. By being aware of the symptoms and risk factors, you can take steps to prevent or address a hernia early on. If you suspect you might have a hernia, it's essential to consult a healthcare professional for proper diagnosis and treatment. Early intervention can prevent complications and improve your quality of life. Hernias often develop gradually, with the underlying cause being a combination of muscle weakness and strain. This strain can come from various sources, including heavy lifting. Repeated lifting of heavy objects, especially with improper form, can put excessive pressure on the abdominal wall, leading to hernias. Chronic coughing, persistent coughing, often associated with conditions like asthma or smoking, can strain the abdominal muscles over time. Obesity, carrying excess weight, puts additional stress on the abdominal wall, increasing the risk of hernia development. Pregnancy. The expanding uterus during pregnancy can weaken the abdominal muscles, making women more susceptible to hernias. Other factors that can contribute to hernia formation include constipation, straining during bowel movements, and even genetics. Understanding these causes can help you make informed choices to minimize your risk of developing hernias. Hernias often manifest as a noticeable bulge or swelling beneath the skin. This bulge might be painless at first, but it can become increasingly uncomfortable, especially when coughing, bending over, or lifting heavy objects. Other common symptoms include pain or discomfort. This can range from a dull ache to a sharp stabbing pain, particularly when straining the affected area. A feeling of fullness or pressure. You might experience a sensation of fullness or pressure in the abdomen or groin area. Nausea or vomiting. In some cases, hernias can interfere with digestion, leading to nausea or vomiting. It's important to note that some hernias might not cause any noticeable symptoms. However, even a painless hernia requires medical attention, as it can lead to complications if left untreated. The treatment for a hernia depends on several factors, including its size, location, and severity. Each case is unique, and the approach to treatment can vary significantly based on these factors. While some hernias can be managed with watchful waiting and lifestyle modifications, others might require surgical intervention. Lifestyle changes, such as maintaining a healthy weight, avoiding heavy lifting, and eating a balanced diet, can sometimes help manage symptoms and prevent the hernia from worsening. Surgical repair. Surgery is the most common and effective treatment for hernias. There are different surgical techniques available, and the choice of procedure depends on the specific circumstances of the hernia. The procedure involves pushing the protruding tissue back into place and repairing the weakened area of the abdominal wall. This helps to prevent the hernia from recurring and alleviate symptoms. This can be done through open surgery or minimally invasive laparoscopic techniques. Laparoscopic surgery typically involves smaller incisions, which can lead to quicker recovery times and less post-operative pain. Non-surgical management. For small asymptomatic hernias, your doctor might recommend a wait-and-see approach, monitoring the hernia for any changes. Regular checkups are essential to ensure that the hernia does not become more severe. Wearing a supportive truss or binder can help provide temporary relief from discomfort and prevent the hernia from protruding further. These devices are not a permanent solution, but can be useful in managing symptoms. Your doctor will discuss the best treatment plan based on your individual circumstances. They will consider your overall health, the specifics of your hernia, and your personal preferences. It's crucial to follow their recommendations to ensure the best possible outcome. Adhering to the treatment plan and attending follow-up appointments can significantly improve your quality of life and reduce the risk of complications. Nature's helpers, herbal solutions for hernia management. While herbal remedies cannot cure a hernia, certain herbs have traditionally been used to support digestive health and potentially alleviate some symptoms associated with hernias. Slippery elm. Known for its soothing properties, slippery elm can help calm the digestive tract and reduce inflammation. Marshmallow root. Similar to slippery elm, marshmallow root can coat and soothe the digestive lining, potentially easing discomfort. Ginger is renowned for its anti-inflammatory effects and can help reduce nausea, a common symptom associated with hernias. It's important to note that these herbal remedies are not a substitute for professional medical advice. Always consult with a qualified healthcare practitioner before incorporating herbs into your health regimen, especially if you have any underlying health conditions or are taking medications. Lifestyle as medicine preventing and managing hernias. Making simple lifestyle changes can go a long way in preventing hernias or managing their symptoms. Maintain a healthy weight. Losing excess weight can significantly reduce the strain on your abdominal wall. Lift properly. When lifting heavy objects, use your legs, not your back, and avoid straining. Eat a high-fiber diet. This can prevent constipation and straining during bowel movements. Quit smoking. Smoking weakens the abdominal muscles and increases your risk of developing a hernia. By incorporating these lifestyle modifications, you can take proactive steps towards preventing hernias and promoting overall well-being. When to seek urgent care. Recognizing a hernia emergency. While most hernias are not immediately life-threatening, certain situations require urgent medical attention, sudden severe pain. If you experience a sudden onset of intense pain in the area of the hernia, it could indicate a strangulated hernia, which is a medical emergency. Nausea, vomiting, and inability to pass gas or stool. These symptoms, along with a hernia bulge, could signal an obstruction in the intestines requiring immediate medical care. Fever. A fever accompanied by hernia pain could indicate an infection which needs prompt treatment. If you experience any of these symptoms, do not delay seeking medical attention. Prompt treatment can prevent serious complications. The importance of proactive health. Taking control of your well-being. Your health is your most valuable asset, and taking a proactive approach is essential for preventing and managing health conditions like hernias. By understanding the causes, symptoms, and treatment options, you can make informed decisions about your health. Incorporating healthy lifestyle habits such as maintaining a healthy weight, exercising regularly, and eating a balanced diet can significantly reduce your risk of developing hernias. Remember, knowledge is power. By staying informed and taking charge of your health, you can live a longer, healthier, and more fulfilling life. Key takeaways, your guide to hernia health. Here are the key points to remember about hernias. Definition. A hernia occurs when an internal part of your body pushes through a weak spot in the muscle or tissue wall. This can happen in various parts of the body, but it is most commonly found in the abdomen. Causes. Common causes include heavy lifting, which can put a lot of strain on your muscles and tissues, chronic coughing, which can weaken the muscle walls over time, obesity, which increases pressure on the abdominal wall, and pregnancy, which can also add pressure and cause muscle strain. Symptoms. Symptoms can include a noticeable bulge, pain, discomfort, a feeling of fullness, nausea, or vomiting. These symptoms can vary in intensity and may worsen with certain activities. Treatment options include watchful waiting for minor cases, lifestyle modifications to reduce strain, and surgery for more severe cases. Surgery can be minimally invasive or more extensive, depending on the hernia's size and location. Herbal support, herbs like slippery elm, marshmallow root, and ginger may help manage symptoms. These herbs can soothe the digestive tract and reduce inflammation, providing some relief. Lifestyle changes. Maintaining a healthy weight, lifting properly to avoid strain, and eating a high-fiber diet can help prevent hernias. High-fiber foods can prevent constipation, which reduces strain during bowel movements. Emergency signs. Seek immediate medical attention for sudden severe pain, nausea, vomiting, inability to pass gas or stool, or fever. These could be signs of a strangulated hernia, which is a medical emergency. Remember, your health is in your hands. Taking proactive steps can make a significant difference. By staying informed and proactive, you can manage your health better. You can take control of your well-being and live a healthier life. Always consult with a healthcare professional for personalized advice. If you found this video helpful, please like, share, and subscribe to our channel for more health tips and information.